The one big beautiful bill this summer promising to reshape Medicaid as we know it, but while some in Washington tout it as a way to reduce costs, rural health care providers here in Pennsylvania say they are bracing for tough times ahead. Good evening, I'm Aaron Leedy.
And I'm Ann Laree. Fox 56's Elizabeth Hakis spoke with one local clinic that's been serving its community for generations about what's to come.
For more than 40 years, Susquehanna Family Health Clinic has cared for generations of families in rural Susquehanna County. But now, as federal Medicaid cuts begin to take shape, staff here say they're worried about the future of small-town health care.
We really feel like Susquehanna needs this resource. Our surrounding counties and our surrounding communities need this resource. And, it's a really, as somebody who lives in a city now, this is a really special kind of care that people get here. It's so much more than medical care.
President Donald Trump signed the One Big Beautiful Bill in July, reducing Medicaid enrollment and funding over the next 3 years. Across Susquehanna County, 1 in 4 adults is covered by Medicaid. And at this clinic, about 1/3 of visits last year were from Medicaid patients. DeWitt says the concern isn't just for the bottom line, but for the patients who may fall through the cracks.
I would say that the passage of that act is concerning to us because we know that anytime you increase the requirements to become enrolled or stay enrolled in a program, people automatically fall off the radar. It's confusing, it's not something people are used to. They may not have the resources or the access to fill out the enrollment paperwork correctly.
The clinic operates as a rural health clinic, part of a federal program designed to keep primary care accessible in underserved areas. But with cuts to both Medicaid and Medicare on the horizon, longtime physician Warren DeWitt says small-town practices like theirs could be stretched thin.
I'm concerned about the cuts in both Medicaid and Medicare. This is not a wealthy area. Well, I told you our Medicaid and Medicare percentage is quite high, so that's where I'm coming from. I want to keep the doors open.
Even with new funding programs like Rural Health Transformation Fund, providers say it's unclear how much of that money will actually reach communities like theirs. Psychiatric nurse practitioner Jan DeWitt says mental health services, while already lacking, could take one of the hardest hits.
Can't afford to, pay out of pocket for mental health treatment, so those are the things that often go to the wayside first, because you've got to have a roof over your head and food in your belly. So I think what we're going to see, as we've seen in the past with Medicare and Medicaid contraction, is that people will seek mental health services less. They'll become more acutely ill. We'll see more suicide.
Back at Susquehanna Family Health, the DeWitts say they'll keep fighting to stay open and keep serving the community that's trusted them for decades. In Susquehanna County, I'm Elizabeth Hakis with Fox 56 News, First at 10.